Three other vulnerable groups identified in the white paper include the elderly, caregivers, and LGBTQ community. Recommendations for vulnerable groups in the white paper include strengthening governance and policy, involving communities of people at risk of suicide and those with lived experience of suicide in all aspects of policy making and implementation of suicide prevention policies. A key feature of suicide prevention efforts across the world is to ensure that people who have been affected by suicide are involved in all aspects of suicide prevention, including policy making, implementation, research, and advocacy, involving individuals who belong to communities at greater risk of suicide, survivors of suicide, and those who have lived experiences of suicide is essential in bridging gaps in suicide prevention. We need to value data and research. Investing in research on the upstream determinants of suicide amongst the vulnerable groups, and to conduct further research to determine additional priority groups in Singapore. There's a strong link between upstream factors and social determinants that heighten suicide risk among vulnerable groups and those who are experiencing loneliness or hopelessness in their lives. More research is required on priority populations that are at greater risk of mental health challenges, self-injury or suicide, and to develop evidence-based interventions that are tailored for these respective communities. Another recommendation is to involve families and communities, strengthening family support initiatives to manage mental health and suicide prevention, and strengthening collaboration with religious and community leaders. Family-focused programs should be developed to equip families with knowledge and skills to recognize early signs of distress, facilitate open and supportive communication, and offer practical strategies to assist loved ones facing mental health struggles. As trusted figures within communities, religious and community leaders hold significant influence and often seen as sources of support and guidance, making them well-positioned to promote mental health awareness and reduce the stigma surrounding suicide. Leaders can foster an environment of compassion, understanding, and acceptance to reduce stigma, as well as play a key role in identifying individuals at risk and providing timely support. Support schools and educators, and here more specifically to adolescents. Establish suicide prevention protocols in schools for suicide prevention, crisis response, and postvention support. In focus group discussions conducted under Project Hayat, participants have expressed concern that school staff, counselors, and teachers may be insufficiently equipped to provide psychological support or conduct suicide risk assessments for students in need. It was also found that many educators may lack the necessary training to identify warning signs, manage crises, or intervene effectively in suicide-related situations, leaving a critical gap in the support network for vulnerable students. By developing and implementing clear protocols and comprehensive training programs, schools can ensure that educators, school counselors, and students are better prepared to respond to suicide risks. And this would involve equipping school staff with the tools to recognize early signs of distress, intervene appropriately, and provide ongoing support to students facing mental health challenges. Madam Speaker, as this is a budget for all Singaporeans, we must continue to find ways to adequately support the many vulnerable groups where these are not yet in place. I have covered those with mental health conditions, persons with disability and special needs, caregivers, and propose for more to be done to prevent suicide. We will need to work together, government and society, to ensure no one is left behind.